Good morning, everybody. Hereby, I open this academic ceremony in which Pragati Hebbar will defend the academic thesis Implementation of Tobacco Control Policies in India, a Realist Evaluation. May I invite you to present a summary of your study and the conclusions of your thesis?
Thank you. Dear Prorector, members of the Corona, colleagues, friends, and family, thank you for joining me today as I share a bit from the journey that I undertook as part of this PhD. Tobacco use is an enormous public health challenge globally as well as in India, with over 266 million adults using tobacco in one or another form. This imposes an enormous economic burden of more than 1% of our GDP. And there is a wide diversity of tobacco products available, as well as prevalence of tobacco across Indian states, from as low as 9.7% to as high as 64.5%. This diversity also extends to the implementation of tobacco control laws. As we see here, based on the Global Adult Tobacco Survey data, states shaded in green depict an improvement of implementation from 2009 to 2016, whereas those shaded in blue show an average performance, and those in red indicate an actual decline in the implementation parameters. The policy response to tackle this enormous public health challenge has expanded over several decades in India. Starting from the early 1900s till 1960s, the evidence on tobacco causing oral cancer was growing. And in 1975, the Cigarettes Act was enacted, which mandated a textual warning on tobacco products. But in late 1980s, the need for a more comprehensive tobacco control legislation was noted and initiated. And finally, over several consultations and evidence synthesis, the Cigarettes and Other Tobacco Products Act, or COTPA, was enacted in 2003. India was also one of the early signatories of the Framework Convention for Tobacco Control, which is a widely ratified global public health treaty. And in 2007, the country launched the National Tobacco Control Program. As COTPA and NTCP are important parts of my study, I will share a bit more details about them. COTPA has several provisions. The four main enforceable ones are the Section 4, which prohibits smoking in public places and mandates the display of such signages. Section 5, which prohibits display of direct and indirect advertisement of tobacco products such as this. The Section 6, which restricts selling of tobacco products to and by minors and also within 100 yards of educational institutes. And the Section 7, which mandates printing of pictorial health warnings covering at least 85% on tobacco packs. The National Tobacco Control Program structures all our tobacco control efforts into a three-tiered system of a national cell, a state tobacco control cell, and district cell, and also with dedicated human resources such as nodal officers, consultants, etc. With this background, my main research objectives were first to describe and analyze how COTPA and NTCP are being implemented in India. Also, to explain the facilitators and barriers for this implementation, and using an implementation research approach to inform and engage policymakers and implementers throughout this process. In the second chapter, I elaborate a bit on the methodology, which is a realist evaluation. And this belongs to a family of theory-driven inquiry methods. Here, the fundamental question that one tries to answer is what works for whom under what conditions? So in the realist inquiry cycle, we usually start with an initial or a rough program theory. This helps guide the development of tools and data collection, and the analysis is usually undertaken in context, mechanism, and outcome heuristic, and we end with a refined program theory. So to start the realist work, I undertook a realist synthesis or a review of literature, searching over 19 databases with the keywords of policy implementation, tobacco control laws, and LMICs. I identified over 2,600 articles, and after screening the titles and abstract, narrowed down on 47 articles. And through these articles, what we were trying to derive were mechanisms that explain how tobacco control policies work in LMIC settings. So here is a simplified diagram capturing these strategies. So at the micro or individual level, the strategy of awareness was found to be working, and awareness of the laws, but also the harms of tobacco use. An example of a mechanism under awareness is normalization. In settings with low awareness of tobacco use, the tobacco usage was normalized, impeding the compliance to the laws. The strategies of intersectoral coordination and enforcement work at a meso or interpersonal level. An example of intersectoral coordination is shared learning. So within a department, when they are able to share and exchange knowledge, that way the coordination is much smoother. An example of a mechanism for enforcement is of fear, and how fear can nudge compliance by vendors and the general public. And the tobacco industry interference is a strategy that works at the macro level, interfering or hindering the implementation of policies. Examples of mechanism include manipulation of public opinion, as well as intimidation of governments by the tobacco industry. The small box of review systems was found only in a few countries like India, Bangladesh, and Nepal, and not in many other LMICs. So now, narrowing down the scope from LMICs to India, I analyzed the global adult tobacco survey data, mainly to select the states for further study and find an association between proxy indicators of implementation and tobacco control, tobacco use in India. Further, we also see that people who were exposed to no smoking signages and those who were aware of the harms of smoking and smokeless tobacco use had a lower odds of using tobacco, while those who were exposed to secondhand smoke as well as tobacco product advertisements had a much higher odds of using tobacco. These findings further support to focus our efforts on better implementation of tobacco control laws. With the same data, the global adult tobacco survey data, as I had depicted the immense diversity across states, I selected 3 Indian states of Kerala, West Bengal, and Arunachal Pradesh. And as we can see on the slide, they are not only diverse in terms of prevalence and implementation outcomes, but also in terms of the socio-political and economic contexts, literacy levels, and other demographic factors, as well as the geographies of each of these states. In these 3 states, I conducted 48 in-depth interviews and over 100 non-participant observations. And later, we also conducted 8 focus group discussions. To give us an idea of the study settings, I would like to share a few pictures. For example, this is a small shop selling tobacco along with other daily essentials in a bus stop. Further, I would also like to share pictures of mainly violations of COTPA provisions. For example, for Section 4 on prohibition of smoking in public places, we found such several instances of flouting the norms in public places, like bus stops and other crowded places. Also, the display of such signages sometimes were in very appropriate locations, but sometimes were also at back gates or had information missing on them. For Section 5, which is about direct and indirect advertising, for smokeless tobacco products especially, danglers like these, forming a power wall sort of a setup, were quite common. And once you have these, passers-by are aware that tobacco is being sold, and it really does not need any further advertising or branding. Further, indirect advertisements like the example above shows that the imagery, color, etc. is same, but the brand name is missing. And such hoardings are also commonplace. The provision on restricting access to minors, in several settings, we found that the vendors themselves were afraid of selling tobacco products near educational institutes. But contrastingly, in other settings, we also found children freely using tobacco products, both smoking as well as smokeless products. And the COVID masks were in fact concealing and helping to hide the usage of tobacco products, especially the smokeless ones. Lastly, on the pictorial warnings, we found several places where the cigarette packets especially complied well with the law, but international brands were often lacking and not complying. And the last image is of a BD packet, in which case also they have the very old warning, and that too with a very small size instead of the updated warnings for 85%. To test and validate our findings, we conducted 2 regional consultations. So one was covering the South Indian states and was conducted online, and the second was conducted with the northern, western, and northeastern states. And the intent of this was to make sure that the strategies that we have identified are relatable, and stakeholders across several departments found these strategies and mechanisms to be relatable. Based on these inputs of data collection in 3 states, as well as these regional consultations, I present the final refined program theory in an ICAMO formulation, which is intervention, context, actor, mechanism, and outcome. The intervention under study is COTPA and NTCP. There were facilitatory as well as hindering contexts, such as robust and active institutions, trust and rapport among stakeholders, active civil society, and trained human resources. And barriers such as a very high prevalence as well as acceptance of tobacco use, low fine amounts which do not induce any deterrence, and tobacco industry interference. As I had mentioned in one of the initial slides, the central question was, what works for whom under what conditions? So I'd like to take you through each of the actor groups. For civil society organizations, the mechanism that they were able to trigger was collective action. And this, through plugging gaps between multiple agencies, was nudging smooth intersectoral coordination. The law enforcers for this category, when the mechanism of felt accountability was not being triggered, the enforcement was very lax or sporadic. For the public, as we witnessed in many settings, fear was the major mechanism that when triggered, it led to compliance by the vendors and the general public, but when it was not triggered, it also led to non-compliance. And for the policymakers, the main mechanism was of prioritization. So here, when they were able to prioritize tobacco control, they were able to pool resources across departments and also conduct and monitor activities well. And in both the consultations, the mechanism of prioritization was the most ratified or accepted one by the policymakers and implementers. With this, I'd like to move to a few research and practice recommendations. So there is definitely a need to develop indicators that measure implementation more closely and incorporate them into existing surveys. And in the realist lens, to further refine theories, because all theories are fallible, and further refinement will only help us improve our understanding of. Last research recommendation is to expand this research beyond only one risk factor of tobacco to other NCD risk factors. And a couple of practice-based recommendations are: one is to clarify accountability pathways and strengthen supportive supervision rather than penalizing only non-performance. And lastly, to update COTPA as it has been 2 decades since its enactment, and the fines are also outdated. Certain clauses also require clarification, and even the manual needs to be updated. I'd like to end with a few sentences from Pawson and Tilley that programs are theories incarnate. They begin in the heads of policy architects, move into the hands of practitioners, and sometimes into the hearts and minds of program subjects. Here, I've presented an attempt to study one such large program and a policy. I would like to thank my mentors, promoters, funders, colleagues, and family for supporting me through this journey. Thank you.
Thank you very much for your presentation. It's now time to start with the opposition, and the opposition will be opened by Professor Williamson. He's Professor of Tobacco Control Research at Maastricht University and Trimmels Institute. Professor Williamson.
Yes, thank you very much. Dear candidate, let me first start with congratulating you with this very important and relevant project and research. Very nice thesis. I think it's a complex topic that you try to approach head on, and I think you did a wonderful job. It's a nice example of how to study a complex issue like tobacco control policy in a low and middle income country. And I think you did a great job, and I think there's a lot to be learned from your research. I also have some issues that I would like to raise and discuss with you. First of all, very simple question actually. The title of your thesis is Implementation of Tobacco Control Policy. Very simple question. What do you actually mean with tobacco control policy? Because it is a very broad concept. Before starting to embark on a research project, sometimes it is very good to narrow it down, to make it more concrete. So what do you mean with tobacco control policy?
Highly esteemed opponent, thank you for your kind words and for the question. So like you rightly pointed out, it is very complex, and there are several tobacco control measures at the national as well as state level in India. And to clarify our scope, we went by the definition of policy, where it also structures the implementation and provides that sort of a clarification. So COTPA, since it is spread across India, applicable to all states, and also provides a guideline on how it needs to be implemented, and it was later supported by the National Tobacco Control Program, we selected these two policies. But beyond that, there are several others at state and national level.
Yes, so you have these two specific Indian policies, state level. So because it is a multi-level governance problem, basically. But what I'm more referring to is the types of policies, because if you want to change the behavior of smokers and prevent young people from starting to smoke, there are several things that you can do. You can do persuasion and education. You can do services, for example, smoking cessation services. You can do taxation, make the price of cigarettes more expensive. So there's all kinds of types of policies that you can think of, and they all together are tobacco control policy. So if you look at these various types of policies, which ones do you think cause the most problems in terms of implementation? Is there something that you can say about that? Because then we can learn a little bit more from your research and look specifically at several types of policies.
Thank you. Thank you for that question. So in India, the policies do map well with the Empower package by the WHO and the global FCTC. So many of these demand reduction measures together come under COTPA, whereas there are several on the supply side as well, which was out of scope of my study. So the main policies that I intended to look at was those that were nudging behavior change across the population, but the matter under study was how the implementers are making sense and implementing these policies, which are in existence since 2 decades in India.
Okay, and in terms of implementation, then how can we be sure that something is implemented sufficiently? For example, if you look at education and campaigns, there's a whole range of things that you can do. You can have a very restricted campaign or a very elaborate campaign involving a lot of money. So when, because you don't define implementation quality as such in your thesis, I didn't find it. So how far do you expect policymakers to go? If you, for example, look at FCTC, there's all kinds of guidelines, and you can use these guidelines to map out the extent to which a policy can be to the maximum be implemented. So you can use that as a sort of a reference. Can you say something about how you look at that issue of, when is implementation sufficient?
Thank you for that question. So as in FCTC guidelines, there are already provisions explained of how we need to implement. In India, we're already doing well in terms of some of the provisions, like for pack warnings, we're already at a very high of 85% coverage. But these are, the laws are in place, but on ground, are they actually being implemented? So I did not, since realist evaluation is method neutral and does not necessarily follow a quantitative or a qualitative method alone, what I was trying to do was try to see how in different ways has it been implemented in different settings. So it was more of a comparison between states rather than defined endpoints or outcomes or quantitative measures that this is the exact percentage that needs to be done. So not in terms of measuring coverage or any other specific parameters.
Okay, but maybe in future research that might be a good idea, right?
Yes, definitely. It would be very good. And in fact, there are several qualitative studies that already look at several of the specific provisions. For example, the provision on signage. So what is the compliance in several institutes in districts or at state level in some cases, or be it of pack warning. And the National Tobacco Control Program helps us with awareness programs. So on how many trainings, which are the stakeholders that have been trained, etc. So those sort of quantitative measures of defined sort of geographies have been conducted and are ongoing. But that definitely helps.
Yeah, yes. Excellent. And maybe a final question, if I still have a little bit of time, is you probably are aware of the WHO Global Tobacco Control Report 2023. There's also mentioning of India. And it struck me that in India, it doesn't do too badly, actually. It has the best practice level in terms of highest achievement of when it comes to putting health warning labels. You already mentioned that. And also providing tobacco dependent treatment, and it actually has banned the sale of e-cigarettes, which we don't have in the Netherlands yet, and a lot of countries don't have that. You say that the results and your conclusions are especially relevant for low-income countries, but if I look at how you are doing in the WHO report, are your results actually most applicable to low-income countries, or maybe also to higher-income countries? And which type of conclusions are relevant for us, for high-income countries as well?
Thank you for that question. So like you rightly point out, India is doing well in terms of enacting provisions. So with great political will, they have been able to enact, especially facing severe resistance from the industry for the increasing pack warnings, as well as even during the e-cigarette bans. But once the policy is on paper, translating it to practice, there is a significant gap in several settings, and it's not uniform that as soon as it's on paper, it will be implemented. That is not usually the case here. So given that, I think over several decades, this body of work has grown, and the policy space has definitely matured. But we need to do a lot in terms of ensuring that action also happens on ground and it can be sustained. Because if we do it sometimes in a campaign mode, which works well in some of our settings, but after the campaign is closed, things again collapse. So for high-income countries, one of the learnings could be the political will that was displayed to at least enact these provisions. Whereas for the lower and middle income countries, the mechanisms that some of which we found of fear, of prioritization are more important, because there are several competing priorities that they need to discuss between.
Okay. Well, thank you for this explanation. It's very helpful and very clear as well. I think it's time for me to hand over and give back the floor to the co-rector.
Thank you very much, Professor Williamson. The next opponent is Professor Kunst, Professor in Social Epidemiology at Amsterdam University Medical Center. Professor Kunst.
Yeah, thank you. I also would like to congratulate you, dear candidate, on this nice thesis, and also your supervisors. Also on the nice design of the thesis. Is very, very nice to look at. Thank you very much for sharing it with us. I would like to ask a number of questions about the methods of realist reviews and realist evaluation. These are really open questions that I also have myself, and I would like to know what are your views on this, the application of the methods. The first question is about the fact that the realist synthesis and evaluation end up with many CMO configurations. In the chapter 3, about 30 configurations. In chapter 9, I see 9 pages of if-then statements. So that's a lot of information at the end of the analysis. And my question is here, how can you communicate this to a broader audience? Because a broader audience, including a reader like me, is not willing to look at 30 CML configurations. You have to, in some way, condense it or to prioritize some configurations. And my question is there a rule, a method to select configurations and to know systematically which ones to highlight and to recommend and to bring to the attention of policymakers?
Highly esteemed opponent, thank you for your kind words and for that question. Indeed, it was quite a challenge for us to grapple with the complexity, because one is just the sheer volume of CMOs that were we were able to generate from the data, be it the articles or the interview data for the realist evaluation. And there were very few examples. I think one of the first realist review was from you and your team, which was very helpful for us to go through, and very specifically on the smoke-free provisions. So guidances like these of worked examples was helpful. Secondly, also the multiple sources of data. So for example, our realist evaluation, we started the initial thing based on our program theory developed through the synthesis, followed by an iteration with in-depth interviews in 3 states, and followed by consultation with individuals from 20 states. So that way we were trying to make sure that the findings that we have from literature to the implementers' wisdom is coherent, and we are selecting the most relevant themes. And based on that, that's how we were able to narrow down on the mechanisms.
Yeah.
How do we... Sorry.
Yeah. Sorry. Yes, now I understand the process, and I also understand how you arrive at selecting the most relevant ones and then communicate these. And I think you have done a thorough process to doing so. I would like to ask another question, because I have many questions about realist reviews. One is that you state at the conclusion section at page 165 that junior researchers struggle with the abstraction process, that is to abstract the configuration out of the original raw data. And I recognize this problem. And you say that there's an absence and lack of sufficient guidance from the realist evaluation methods. My question is this, is the problem the lack of guidance, so that we should have more guidance? Or is the problem that it's just very complicated, very difficult, and that we should And in the latter case, perhaps then we should only let research to be done by people who are really proficient in research. What do you think? Guidance, or just give it to only proficient researchers?
Thank you for that question. In my experience, I think initially my thought process was that the guidance is lacking, but the more I read and the more I tried to find, I could find, especially from experiences of realist researchers, that it is possible to do, although there's no step-by-step guidance. So I believe that it is more about understanding and grasping the complexity and doing it. So, and from the synthesis to the evaluation, I also see that my own capacity has sort of increased in grappling with this complexity. So I feel that it is possible to do and should not be restricted only for someone who is an expert so in realist, but it is possible. And maybe with consultation and reflexive discussions with experts and learning from worked experiences, it is possible to better conduct a realist study.
Okay, thank you. That's a very clear answer, and that is encouraging for doing the reviews also by junior researchers. I have another question that links to that. I have noted that myself, when I'm now doing research or let PhD students do research, that I don't do any more realist reviews, but I think I'm just doing qualitative research using the standard guidelines for thematic qualitative research. And what I ensure is that the right questions are asked, the questions of what works and why. Just doing qualitative research and let's be the topic guides and analysis guided by the question, does it work and why does it work? And with a focus on the actors and the processes. And without anything, they don't need to read Paulson. They don't need to have to summarize it in CMO configurations, just qualitative. What do you think? Is that a good way, or is this the wrong way to go ahead?
Thank you for that question. I have seen several realist-informed qualitative work where they necessarily do not go into the depth of using only the CMO or ICAMO iterations for analysis, but rather go with a thematic coding and a qualitative study. I think the question should guide our inquiry. So depending on the question, if we feel that the focus is on generative mechanisms, on trying to explain how things are working or not, maybe going and using a full realist method or approach would be helpful rather than a qualitative study. But there are several questions that could be answered by qualitative, and we should not try to force a realist lens onto it.
Thank you very much. I'm very satisfied with the question. I would like to give the word back to the chair.
Thank you very much, Professor Kunst. The opposition will be continued by Professor Aurora, Vice President of Research and Health Promotion at the Public Health Foundation of India. Good afternoon, Professor Aurora, the floor is yours.
Thank you very much. So, dear candidate, at the outset, I would like to reiterate what the earlier opponents have mentioned about your work. It is definitely a high quality research undertaken and is unique from the point of view that very few tobacco controlled research studies, especially in India or in low and middle income country context, have looked at using an implementation science framework and an approach to be able to understand the implementation. So it is a rigorous methodology and need of the hour. So congratulations. My first question is around why did you choose implementation research design for your research question? And why I ask is that usually we use implementation research to be able to study implementation of an effective intervention, an evidence-based policy and intervention. So did COTPA and NTCP had all that effectiveness components in place when you chose this?
Dear highly esteemed opponent, thank you for your kind words and for the question. Yes, so the question about using an implementation research or an implementation science framework is because many a times the implementer's wisdom is left out, and the worlds between research and implementation seem to be wide apart because they didn't seem to be talking to each other, especially in our own experience of working in the area of tobacco control for a few years prior to initiating this doctoral journey. Now, is there evidence sufficient to look at it from an implementation science point of view? The NTCP was launched in a phased manner. So it started with a few districts, and then looking at how it was being fared, it was then moved up across all districts in India. And there were some studies mainly pointing out at implementation lacunae. Much later, I think in 2019-20, we had studies which showed some associations between the effectiveness of COTPA and NTCP, or the lack of effectiveness rather. So at the point when I started, it was more that it is the available law in India and has been scaled up across all Indian districts. And that's the reason why I started.
Okay. But there are other policy measures beyond COTPA and NTCP, so which is Article 5.3 guidelines, smokeless tobacco ban in India, e-cigarettes ban. Do you think all of that is left out?
Indeed. So as it was also noted that there are several state level and national level measures. So e-cigarette in terms of timelines came much after I had initiated my study. But at the time when I was initiating, I was still thinking through whether the state level bans on smokeless tobacco as well as taxation and other regimes need to be studied. But owing to the complexity that COTPA and NTCP already cover with the different provisions and actors involved, I thought it wouldn't make that much of a detailed, we won't be able to provide detailed findings from if we take up all the policies together. And hence I chose these particular policies.
Thank you. My next question is, if you can please elaborate on the process of how you developed your initial program theory from the systematic literature review that you have mentioned. What were the steps you followed?
Thank you for that question. So initial program theories can be developed using several sources. It could be former literature. It could be also interaction with stakeholders. For the purpose of my study, I based it on a theory gleaning phase where I looked at available implementation theories such as the COMBI, normalization process, CFIR, and others, and then try to narrow down on what are the specific things related to tobacco control that they bring in. And based on our own experience of working in the field, interaction with a few national level experts and the existing theories, I developed the initial program theory.
A follow-up question to that is, since you looked at the literature from other LMICs as well, and India is unique in terms of tobacco control, prevalence, and the kind of products we have available. So did that literature actually apply to Indian context, and or you had to make adjustments in your theory?
Thank you for that question. As you rightly point out, we initially put the scope at LMICs, but as we studied more and more policies, we realized that the contextual factors are very different, and just an economic categorization of these countries is not very helpful. And especially for India and the neighboring Southeast Asian region countries, the context was somewhere comparable. But for Sub-Saharan Africa and other contexts, it was very diverse. And in our synthesis, we reflect on this a bit.
Thank you. Just curious about how, so you have mentioned that you did a systematic realist literature review. So how is it different from the regular systematic review in terms of methodology and analysis plan?
Thank you for that question. So the key difference here is one is in the analysis, because in the realist review, we will use the CMO framing. So even when we are coding and going through the data, that would be the lens that we would be applying, looking out for mechanisms, looking out for the actors, contexts, etc. Whereas in the systematic reviews, more of trying to quantify and give the weightage of the evidence that exists. So that also is not the goal here in a realist review.
Thanks. Next question is around the regional consultations, where you included more states as compared to your 3 study states, which means the context and even the policy environment would have been very different. So did those data points of the regional consultation refine your already refined program theory? And if yes, what changes did you bring about?
Thank you for that question. So the regional consultations definitely helped us, as we wanted to make sure that the findings are generalizable to other contexts as well, and they are not out of line or something that has not been experienced by other states. So when we presented our refined program theory and these strategies, the stakeholders that engaged with us agreed and helped us refine. So from the refined program theory 1 to refinement 2 that I have explained in the thesis happened based on these inputs from 20 stakeholders. And we were able to narrow down on the 4 mechanisms based on this second refinement.
But can you be specific on what the refinements were in terms of whether you expanded or you deleted on some of the pathways that you have established?
Yes, so we, in our 8 focus group discussions especially, we discussed each of these themes, the strategies of tobacco industry interference, of intersectoral coordination, enforcement, etc. And we presented what we already had taken from the interviews. So we were seeing whether they refute it, whether they refine it. So there were no refusals in any of our findings, and most of it was agreed. And what we were able to do is, from the bulky several pages of detailed if then because propositions, we were able to pick on these 4 mechanisms as we try to synthesize or consolidate our findings. So these 4 mechanisms mainly arose from our interactions with the 20 state stakeholders.
So I have a last question. Do I have time?
No, I'm sorry, your time is up. Thank you very much for the questions. The opposition will now be continued by Dr. Abidi. She's assistant professor at the Department of Health Promotion at Maastricht University.
Yes, thank you. Dear candidates, I would like to congratulate you on the excellent work that you've done in your thesis. I noticed in your investigation that you were very mindful of the complexity that exists in various settings in India, with also multiple competing interests, actors, and the various levels at which policy implementation occurs. I think that this realist approach embraces that complexity and allows you to identify really well and very specifically also all the different contextual factors that trigger mechanisms and also can lead to certain outcomes. So I think you were very meticulous in using this approach, and this led to very interesting insights and knowledge that I think can also be very helpful for policymakers in various countries. So thank you for that, and very well done. Moving on to my question. In chapter 5, you investigated facilitators and barriers to implementing the COTPA and the NTCP in India using this realist evaluation. And specifically, you investigated this in the states of Kerala, Arunachal Pradesh, and in West Bengal. In general, you saw that in West Bengal and in Arunachal Pradesh, tobacco control efforts were low in comparison to Kerala, in which there were more strict enforcement of the law. In West Bengal and Arunachal Pradesh, there was no fear towards non-compliance of the law you mentioned, and also low accountability of officials. What was interesting is that you mentioned that these policies can basically be categorized into sermons, sticks, and carrots, and you mentioned that there was also some intense discussions among stakeholders from these states. These discussions were about the strict enforcement of the law using sticks, for example, versus the more awareness creation, which is more the sermons. So my question is then, what about the carrots? Do you think that carrots can be important policy instruments in states such as West Bengal and Arunachal Pradesh? And if so, what specific policy instruments might then be important to implement and investigate?
Esteemed opponent, thank you for that question and your kind words. So like you rightly point out of these three, the carrots, sticks, and sermons, the one that is mostly used is of sticks or enforcement. In Arunachal and West Bengal, would now carrots work? So in my recommendations on the last slide, I had mentioned supportive supervision at district and sub-district levels. And that is something that is not very frequently done. Usually the monitoring or review is more in a way that you're penalized if you have underperformed or not performed whenever the review meetings and other things happen. But it is not so much about appreciating and supervising with a positive connotation and trying to empower the officials. So given this contextual background, it is definitely important to bring in more in terms of empowering officials to take things up. Because in Kerala, there is a long path dependency of tobacco control efforts, whereas in West Bengal and Arunachal, in West Bengal, it is the tobacco industry also, strong presence there that interferes. But these two states can benefit from supportive supervision at district and sub-district level where the action needs to happen.
Okay, thank you. And next to these supportive supervision, might also more economic incentives be effective? Or do you think about, for example, economic incentives?
Economic incentives is also a possibility because many a times there could be fund release delays, or there could be other pressing priorities that the funds get utilized into. Especially in Arunachal, the geography itself is difficult. It's quite an hilly terrain, and there are several other issues that interfere with prioritizing tobacco control. So if there is sufficient economic support available, then that could also act as a carrot or an encouragement for them to take up implementation.
Okay, yeah. Okay, thank you. And then I have one more question, more specifically about Chapter 3 and about how those results can also be applied to Arunachal Pradesh and West Bengal. Because you in Chapter 3, I think you identified a lot of these configurations, and I found it a very impressive piece of work with some really interesting findings. And you kind of categorized these mechanisms into 4 main strategies that you also presented: awareness, enforcement, intersectoral coordination, and tobacco industry interference. So these results are then more generally applied to middle and low income countries. And I looked at all the lists of these various countries that you looked at, and it's really nice to see all the diverse countries that were included in this chapter. But when you compare it to chapter 5, we see also that there is some partial overlap in the results, which is understandable. So the strategies of awareness and enforcement come back in the results of chapter 5, right? You see that, for example, in the 3 states in chapter 5, the need for enforcement and awareness is quite clear there. But I thought, what can we learn from other countries in terms of, for example, improving intersectoral coordination, which was one of the main findings of chapter 3, and also fending off tobacco industry interference. So what can we learn then from other countries that we can perhaps then apply to the specific states of West Bengal and Arunachal Pradesh?
Thank you for that question. So in terms of intersectoral coordination in some of the South Asian countries, we saw that shared learning and a group identity helped. So this was when diverse stakeholders had a unified or a shared goal and vision. So especially in our settings, it is health department which is steering this entire process. And for other departments, it is an additional responsibility to support enforcement or awareness building activities like the police or the education department. So it is not their shared goal and the buy-in is not so much. So hence, another recommendation is to also make sure that these departments are engaged upfront in the policy making and adoption processes rather than bringing them directly into the implementation phase. And for the tobacco industry interference, especially since West Bengal, there is several instances, be it based on CSR or other, where we can find industry interference at various levels. One possibility is that now several states are adopting the 5.3 based guidelines and ensuring that they minimize interactions with industry and also ensure that there is transparency. But here again, the health department versus other departments are a bit at loggerheads, where health department knows the importance of this, but in the other departments, that sensitization may not be there. So trying to spread that awareness about the importance of minimizing industry interference to other departments, and then ensuring measures of transparency, etc., would be helpful.
Okay, thank you very much.
Okay, thank you very much, Dr. Abidi. Then we go to the last opponent, Professor Kitz, Professor of Behavior Change and Technology at Maastricht University.
Thank you very much, dear chair, dear candidates. Also my congratulations on your beautiful thesis. I think a highly relevant topics, and I think you clearly showed that you're an expert on it. You already have many publications on the topic, and I also saw that actually during your PhD you had a lot of even more publications on other relevant topics. So I think you're truly an expert. And what I appreciated in your thesis was the focus on the policy level using this realist approach that we've been talking about a lot the last hour. And you did so in a setting where I'm less familiar with, and that kind of serves as a bridge to my question. Because already in the introduction on page 16, you show this map with all these regional differences, which were quite huge, I would say. So I thought that was immediately interesting. So that raised the question, of course, why? And then I went to your review protocol in chapter 2, and there your aim is, and then I quote you, to identify context-specific evidence-based strategy to gain insight into the implementation process. And as you might know, I come from a department of health promotion, and I'm raised in the intervention mapping tradition. And there we always try to make a link between like strategies or change methods to specific determinants or facilitators or barriers, whatever causes the problem. So in that light, I would like to go with you to page 59 in chapter 3. And on that page, you present this refined program theory. And I think Dr. Abidi was already referring to that. Like you have all these determinants or factors at the level of the micro, the meso, the macro, and so on. And then you have these several strategies. But there's only like one arrow between them, or well, actually two, but basically it's saying these two are related. And maybe my first question is actually, how are they linked? in the sense of like, or to what extent are these strategies applicable to all levels or for certain levels and so on. So can you shed some light on how you see the link between the context and these mechanisms, besides that they are related, but are there specific preferences or things you should or shouldn't do according to your opinion?
Highly esteemed opponent, thank you for your comments and the question. So, like you rightly point out, this was an first refinement based on the literature, where we moved from an initial version to this, and we've put together all of the contextual factors, mechanisms under strategies and outcomes. But as we did this, we realized that which of these are working at which level. And hence in the next page, I had presented that simplified version where awareness was working at the micro level, intersectoral and enforcement at the meso, and tobacco industry at the macro level. And in our last refinement, I get to the actors and specifically which mechanisms work for which actors. So it's over these iterations that I have been able to draw the linkages. And initially it was all boxed up and we were trying to see that, okay, they are related, but not clearly which one is related to which one as we start.
Thank you. That's really helpful. And of course, that was like an overview of the international literature in low and middle income countries. And then how does that help me? Like, or is that also helpful to understand, to go back to these regional differences that I see on page 16? Do you also see there that there's differences at these strategies implemented at by these different actors?
Thank you for that question. Yes, indeed, because the contextual factors in many of these states are very different. So, for example, in Kerala, it was that enforcement was so overt, visible, and palpable to the general population. And this was also agreed by several other states where they were able to pull off such timely and periodic enforcement, but not true for many other settings. So within India itself, further research can be expanded to other states to see which of these can be scaled, and there is preparedness among the system to scale these strategies.
Okay, so that in that sense, that also helps you to kind of go towards policy recommendations in that regard.
Indeed, yes. Thank you.
And then a follow-up question, I think basically continuing where you also already had a discussion with Professor Kunst. You talked about the complexity, and I think you kind of made a case that yes, it can be done. It's really complex, but it can also be done by a junior researcher. But my question is more, how did you do it? Of course, there was a brief analysis paragraph, but you go from these 300 configurations to a kind of synthesis. But can you shed some light on how this synthesis process worked?
Thank you for that question. So, especially in the realist synthesis, I was initially grappling a lot with the complexity and the huge number of CMO configurations that I had developed through the coding and reading. And after this, with the help of mentors who have already conducted realist work, we organized a workshop, sort of a model, where we brought these CMOs under each of the strategies, and people who are active in realist work were looking at this together. And they were also helping us to see whether these are coherent, they're making sense or not. And after those workshops with realist researchers, I was able to then finally develop some of these visualizations, and it helped in the sense-making process of the analysis of the synthesis.
Okay, so you did this categorization maybe as a first step then, and how was that categorization fueled? Was it like a data-driven thing, or was it like, did you have a code tree already beforehand specified, or how did that work?
So the initial program theory had these few strategies that we were already looking out for. So the categorization under those was helpful based on the initial rough program theory that we had. And after that, with discussion and working with the stakeholders, we were able to bring it to the category.
Thank you very much. Time is up.
Thank you very much. Pragati Hebbar, the time appointed for defending your thesis has passed. The degree committee will now withdraw to discuss the quality of your thesis and your defense. I request that you and your company await the results of our deliberations and our return.
Thank you.
You're still unmuted.
How did that happen? Oh, well, welcome back. Thank you for waiting for us. Pragati Hebbar, the degree committee here present online, has assessed the quality of your thesis and your defense. In view of its positive verdict and taking into account your previous qualifications, the degree committee has decided to grant you the degree of doctor. Professor Nagelhout is authorized to confer upon you this academic distinction in accordance with Dutch university custom. I invite your supervisor to now take the floor.
Do you promise to work in accordance with the principles of scientific integrity at all times, to be careful and honest, transparent, independent, and responsible?
Yes, I promise.
By the authority vested in us by law and in conformity with the decision of the committee here present online, I hereby confer upon you, Pragati Bhaskar Hebbar, the degree of doctor and grant you all rights attached by custom and law. As evidence of this, you will soon receive the degree certificate signed by the rector, the secretary, and the supervisor, affixed with the official seal of the university, now shown by the beadle.
Thank you.
And now I give the word to Upenda.
Thank you, Professor Nagelhout, and all the co-supervisors for giving me this opportunity to say a few words about Dr. Pragati Hebbar. Wow, what an incredible moment of proud for me and many others. Many congratulations, Dr. Pragati Hebbar, for this very richly deserved award. You also have been bold, innovative, and meticulous in using a new kind of theory-driven method in evaluating tobacco control policies, probably for the first time in India and in the region. So many congratulations. I like to remember when we met first. I think it was 2012, more than a decade ago, that you came to Institute of Public Health, Bengaluru, and joined my team. You came as a specialized dentist who wanted to move to public health. And you joined us as advocacy officer, and it was very new. Everything was new for you. But you had a very sharp learning curve, and within a very short time, you became a team lead, you expanded the team, you started assisting us on research, you started publishing in scientific journals. And I think in 2018, when you were a young mother, you received what has been very prestigious and competitive award, which is DBT Wellcome Trust India Alliance Early Career Research Fellowship. I guess this was the first independent research grant that you received. And I'm so glad that you decided to register for PhD, to do PhD as part of the fellowship. And I think you not only completed the fellowship in an excellent manner, you did many more things. You became assistant director at IPH Bengaluru, the first woman in that position. You got elected as a member of the Health System Global Board representing the region. You developed many training programs, including on realist evaluation, on implementation research, and offered them to fellow Indians. And all of these you did while actually successfully completing and now defending your PhD. That's an outstanding sort of achievement. And I know that this has been an incredible journey, but there have been times when you were overwhelmed, when you felt low. And there have been many colleagues at the Institute who have been a great support to you. I was speaking to many of your colleagues, and they had many things to say on this occasion. Of course, time won't permit me to convey all of those things, but I did put those things through a word cloud, and let me read out some of the words that stood out in there. These are the words by your colleagues for you, that you are active, organized, you are very cheerful, you are composed, you are friendly, you are kind, and you are calm. Of course, you are these and many more things. I should also not forget your family. PhD is not just an outstanding individual journey. This is often made possible by very supportive family. Family also suffers and sacrifices for such journeys. And I would like to remember Mr. Guru Praveen, who is Pragati's husband, but who also happens to be a good friend of mine. And he has been an excellent supportive partner, and he had a message for you, Pragati, and I thought I must read that message for you. So this is from Mr. Guru Praveen for Pragati. Dear Pragati, congratulations on your completion of your PhD. It is a monumental achievement and first in our family, and I couldn't be happier for you. Your dedication, hard work, unwavering commitment have paid off. It hasn't been an easy journey. Juggling between multiple roles, taking care of both me and Navinya. Navinya is Pragati's daughter. Managing both office and home, and dealing with a lot of travel and staying away from family. The mental stress you went through, and almost burnt house with all this chaos. These were all part of your journey. Some days were long, tiring, and frustrating, but you persevered. And you, and then he writes in bracket, we sacrificed so much to reach this milestone. Your resilience in the face of adversity has been truly inspiring. And I'm excited to see where your new path takes you. I know that you will continue to make a significant impact in society. And you know that I'm always there with you, no matter what journey you take. So congratulations on your very well-deserved success, my brilliant wife. I'm incredibly proud of you. Thank you, Guru, for that message. We indeed all are proud of you, Dr. Pragati. And lastly, I will remember Navinya, who is going to turn 8 soon. She is an incredibly talented child, and she is an artist, and she did a beautiful mandala art. I think one of the jury member appreciated the cover design. So you see the art done by 8-year-old daughter of Pragati on the cover design of her thesis. And I must show you the photo when Pragati presented the thesis copy to her daughter, how delighted she looked. I'm sure she was happy not only to see the cover design, but I think she was happy to learn that her mother has completed PhD and will have more time to give it to her. So all in all, an incredible journey, and many congratulations again. I look forward to keep working for you. And I see already a couple of students who wanted to do PhD under you. So many congratulations again. A wonderful success and many more success to come in life.
Thank you very much. Dear Dr. Hebbar, also on behalf of Maastricht University, I congratulate you with the degree you have obtained. I also congratulate your family, friends, colleagues, of course, your supervisors, and I'd like to thank all the members of the degree committee for the work they did for this PhD defense and their presence here online. Special thanks, of course, to our guests from outside Maastricht University for taking the time to be here online. Your input is really very much appreciated by Maastricht University. Dr. Hebbar, hearing what you have so far achieved in your career, I think I have no doubt that you will continue having a successful career and hopefully combine it with your private life in a more quiet way now that the PhD has been obtained. And with this, I think it's now time to relax, enjoy that you have obtained a doctorate from this university. And with this, I'd like to close this academic ceremony.
Thank you.
Congratulations, Pragati. You did really well. I'm really proud of you. We've already thanked each other last week during our call and some email exchanges, but I'm really, it was really nice working with you, and I'm really proud of you, how you've done so far. and also that you have